The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. I want to remind you about my course for perimenopausal women. After speaking with many, many women who are in this phase of life, I have developed a comprehensive course to help address the symptoms that so many women experience in their 30s, 40s, and even early 50s. I launched the prototype, a live version of the course, on January 31st of this year and have completed 7 weeks of the 8-week course. Yay! When this prototype course is complete, a final version of the course will be produced and available for you to take. If you would like to talk to me about the course to see if it is the right fit for you, there is a link on our website, itchyandbitchy.com, and our Facebook page, IMB Podcast, where you can schedule an appointment for a Zoom call with me. I am so happy to have with me today my good friend and brilliant journalist, David Allen. He has been kind enough to join while we are on vacation in beautiful Anna Maria Island, Florida. Lovely weather. We're not in that lovely weather, are we, David? We're inside.
We are. We're inside right now, but the lovely weather was the bribe, and I took it to be with you today to talk about some important subjects.
Yes, absolutely. Absolutely. And we have talked off and on over the years about medicine, the state of medicine in the U.S. today. And you pointed out to me a blog from the American Academy of Family Physicians website about appointment wait times.
Yes, and it caught my eye because in talking with a lot of friends, they mentioned how long it took to get in to see not just their primary care physician, but also to see a specialist. And I thought this would be a good topic for us to talk about because what's the story behind those numbers and those statistics? And is there one? And what is it? More importantly, for people who are listening to be able to get some good information from. And I think we are seeing what those numbers are suggesting. What do you think?
I absolutely agree with you. And it's interesting in that blog that they cite the all the statistics, but they don't really explain in that blog or theorize in that blog why this is happening. So that leaves us for the job, doesn't it?
Yes. And I was thinking, is it because there's a shortage of specialists? And you're suggesting that's probably not the case.
Yeah, because specialists are going to make a lot more money than a family practice physician. And so a majority of people graduating from medical school are going the direction of specialties because it's so much more lucrative. And it's a narrower field, so it's, you don't have to know about every little thing that happens to the human body. Not that they are being lazy or anything, but it's just, when you have a focused practice, there is an ease about it in that you can just get more and more detailed versus trying to get broader and broader and broader when you're a family practice provider. So, yeah. So I don't know that it's a shortage so much, but I theorize, and I have nothing to prove it, but I theorize that it's because one of the reasons is that our commercial insurances and Medicare Part A and B, A is the hospital, B is the medicine or medical care insurance, all of those types of insurance allow for self-referral to specialists. So, if you can pick up the phone and schedule an appointment yourself with an ENT, and that may not be your problem, it might not be an ear, nose, throat problem, nobody's there guiding you in the right direction in terms of specialty. You're allowed to just schedule an appointment whenever you want with a specialist you want.
I hear you saying paging Dr. Google. Paging Dr. Google. Is that part of it as well?
Yeah, absolutely. Dr. Google, my buddy, love of my life.
Yes.
Yes. So the problem with Dr. Google.
And we've all used Dr. Google,
Yes,
let's admit.
Yes. Well, I haven't, but yes, the problem with Dr. Google is that people put in their list of symptoms, and of course, a jabillion kind of diagnoses come up. There's no narrowing of the diagnosis based on your history, your family history, your symptoms, a physical exam, the signs versus the symptoms. So you get this long list, and I think probably cancer is the top 20 of them, for whatever symptom you put in. It just freaks people out. Yeah. And the other thing is, we have the Apple Watch, which monitors your heart rate. You can have an EKG app on that. So, and I'm not saying they're inaccurate necessarily. I honestly don't know the level of accuracy that those apps have on the Apple Watch, but they're not. We don't use them for diagnosis. Let's just put it that way.
Right. Let's talk a little bit about the numbers that we're seeing, so people who are listening might be able to say, "Yeah, that's about what I'm seeing," or "I'm not quite seeing that." Yeah. But what are some of the statistics here?
So cardiology, the average wait time is 26.6 days, 27 days, and that's up 26% since 2017. And this survey was done in 2022. So in 5 years, up 26%. Dermatology, 34.5 days, which is up 7%. Obstetrics and gynecology, 31 days. And that's up 19%. And orthopedic surgery is the winner, not by number of days, but by percentage. Their wait is 16.9 days on average, and it is up 48% since 2017.
And a lot of your listeners would be concerned about the obstetric and gynecology visits and their health and well-being.
Yeah. I mean, if you're having a gynecological problem and you have to wait a month to get in to see somebody for that problem, that ain't good. And I'm not even talking about pregnancy things, even just GYN things. If you're having heavy bleeding or prolonged bleeding or a vaginitis, I mean, that's miserable. It might not kill you, but it's miserable. You don't want to wait a month to get that treated, I don't think. I mean, if I polled a bunch of women, I'd say they wouldn't want to wait 31 days, but
right.
Yeah.
So health outcomes can be at risk as a result of the waits.
Yeah. Yeah, and if you say you're having, for instance, a vaginitis, and it's something like chlamydia, and you wait a month or more for an appointment, you risk having infertility down the road. The chlamydia is easily treated and easily prevented, by the way, with condom use. But you could end up with infertility if it's not treated in a timely manner.
So what would you recommend your listeners do about those waits so that they can maintain good health?
Well, a couple of things that can help include, if you're already established with a specialist, when you call to make an appointment, if they give you a time that's 30 days out, 40 days out, whatever, ask if they have a cancellation list and get on the cancellation list. Ask if they don't have a cancellation list, ask them if you can call every day their office and ask for if there's a cancellation that day. Mm-hmm. And you can do that. I mean, the onus shouldn't be on you, but sometimes you just have to be proactive in order to get what you want. So, I mean, those are a couple things. And then use your primary care physician as a resource. Go to them first, see if you need to see the specialist, and they can often help get you in a little sooner.
I was interested by the wait times, which are increasing for orthopedic surgeons.
Yeah.
That was one of the bigger increases.
Yeah, I'm a little bit surprised by that, too, because I know that we have 3 big orthopedic groups in Knoxville, and 2 of them have established walk-in clinics, for sprains, fractures, this, so you would think that would take some load off so that
Right.
that number would have improved. It's odd. I don't know if you have walk-in clinics for orthopedics in your area, but I think it's helped a lot in terms of their wait times, but and in terms of reducing their wait times. But I don't know if that's sort of an across-the-board happening. I don't know.
I wonder too about all of the hip and knee transplants that are taking place
Amongst
today.
we boomers.
Amongst we boomers, yes, I would have to say many boomers, yes.
Well, and we're in addition to boomers having their joints aging and overuse injuries and joint replacements and blah blah blah. We're in a big university town, and lots of sports, and a lot of these orthopedists are the specialists for these athletes who are in college. So their time is also taken up doing a lot of sports medicine. So I don't know, that may have a role too, is if you're taking care of the whole football team, you might be in line after the football team.
You might be. But I guess it's encouraging to hear that maybe at some level we're all active today. We're riding bikes and we're running still and hiking and doing all these types of things that, yes, they could possibly lead to injuries. But I guess there's a certain good news story there that we're getting out and being active.
Absolutely. I mean, you're an avid golfer, and that can cause all kinds of shoulder and neck and upper back problems, low back problems, but you're out and exercising, and that's a good thing. Some of it is getting better at mechanics, and self-care.
So your advice for people who are waiting these long times to see a specialist is, I hear you saying, number one, make sure that you really need to see that specialist, because you might not have that problem, but you might be taking up a slot for someone who does need to see that specialist.
Absolutely. And I think, David, after this break, we should talk about who you should see and why you should see this person to determine if you really need a specialist.
Ooh, a little mystery.
I know.
All right, we'll solve that after the break.
Hang on. We'll be right back. We are back, and we are back with David Allen, a fabulous journalist and great friend. And we're having a great time at the beach, and thought we'd share some information with you while we're here together. And it's been a fun journey, a little tricky. I'm not great at the remote recording thing.
Right, but you're getting there.
I'm getting there.
It's encouraging.
And I've always told all our listeners that Forrest is the deal, and Forrest saves me, throws me lifelines, IT lifelines, and guess who's not here? Forrest. Anyway, we're doing our best. So anyway, David, so we read the wait times for the specialists and what percentage it has increased
Significantly
since 2017, survey done in 2022. Family medicine, the wait time is 20.6 days, and that is down 30%.
That surprised me a bit, because a lot of people I talk to are most frustrated with the wait times to see their primary care physician.
Interesting.
But overall, it appears as though those wait times are going down. Whether it's, I just know people who are going to a practice that's in some degree of transition or is taking on new patients. But in fact, we know that wait times for your primary care physician across the country are going down, which surprised me. But I think there's some important reasons why.
Yeah. Oh, I know there are important reasons why. Well, one is, and I know our practice has done this, there are urgent care practices out there, and they're sort of the type of practice that you can go to, especially if you have an injury or something that needs to be taken care of quickly, but is not an emergency room visit.
Correct.
So we have urgent care clinics. We have what they call retail clinics, and those are the minute clinics that you often see in the big box pharmacy stores. And we have telehealth, thanks to COVID. I mean, we had telehealth before, but we have a massive increase in the use of telehealth since COVID. We all figured, we can do this, and we can bill for it. Hallelujah.
But all of those that you just suggested do have some element of limitation, correct?
Sure. I mean, the urgent care clinics, although there are a couple that I know of that also provide primary care, these urgent care clinics are for that. They're not there to unless they offer primary care, they're not there to manage your high blood pressure long term. No, they don't do chronic disease management. They'll, cast your broken bone and fix up your sprain and suture your cut and do an x-ray if they think you have pneumonia, etc., which are all fantastic things, and I'm glad we have those urgent cares to do that. But they're going to say, your blood pressure's up at this visit. Go see your primary care and get that checked out.
Right.
And the retail clinics and the big box stores are great for, vaccinations. If you have a urinary tract infection, a sinus infection, some of the simpler problems that pop up. They're not going to do complicated things. They're not going to do x-rays. They're not going to do wound care or suturing or casting. They're just not going to do any of that stuff. So that's a really limited source. And then the telehealth, the fact is 80 to 90% of your diagnosis is based on a really good history taking. So if you've taken a really good history, which you can do over at telehealth, you can nail a diagnosis most of the time. Now, there may be times that you want to have some testing, and even the telehealth clinics allow for that and say, okay, I'm going to call you in something for your urinary symptoms, but I want you to leave a urine sample at this clinic.
Right.
Yeah. So, it is a lot more flexible and useful, and something that really is appealing to millennials because accessibility is their deal. Not that the rest of us don't want to have accessibility for our medical care, but it's really important for that age group. And having a patient portal allows for a lot of great accessibility to your provider. And your information, your labs, your test results, all that. So I think that the good thing about COVID is that we did a much better job in the medical field in improving access and availability to your information. We're forced to,
Sure. I know that a lot of the big box pharmacies right now offer so much. And I think COVID kind of pushed that. I've gotten a lot of my COVID shots and booster shots at the big box pharmacies. I know you really believe in being proactive, in being a real, being proactive for your own health. Would you suggest that one should become real familiar with what all of these places offer? So if you have an issue, you know what's your best place to go if you can't get into your primary care physician.
Absolutely. And, because things, you know how things happen. It'll always happen on Friday night or Saturday morning, so you're not going to always get into your primary care for the problem. So it is helpful to know, because there's a lot of people, a lot of my patients, I had to teach them that, if you have a laceration, if you haven't cut a tendon, if you have a laceration, go to an urgent care clinic. Don't sit in an ER for 6 hours, because they can suture you up and get you out of there, and you haven't been sitting in an ER with a bunch of sick people. So, it's helpful to know what services certain clinics provide and what they don't provide. It's a very good point. And, there's, I put together a list of urgent care clinics that are across several states. So there might be one near you. There's a company called Concentra Urgent Care, Concentra Urgent Care, and they have over 300 clinics in 38 states. MedExpress Urgent Care has 180 clinics in 16 states. And American Family Care, which also owns Doctors Express, has 163 clinics in 25 states, and that company offers primary care. So if you don't have a primary care physician, that might be a good option. Next Care, Urgent Care, 137 clinics in 10 states, and they also offer primary care. So, for those millennials listening, that might be those that offer primary care might be a really good option. And the urgent cares also offer vaccinations and school physicals and sports physicals and DOT physicals, that kind of thing.
Is it safe to say that the urgent care places can do everything that your primary care physician can do?
In terms of an urgent acute problem, pretty much. And some of them might do more, because there are primary care providers who don't do wound care and suturing, don't do casting of bones. We don't do any casting of bones in our office. So, they might do some things. They might be able to do more of. Like some urgent care clinics even have CT scans, so they can do check for kidney stones. We don't have a CT scan in our office,
right?
So there's they can be really beneficial, and but I still think you want to have a primary care provider for some continuity of care, and someone who's looking at the whole picture, because there are a lot of pieces. I mean, if somebody's going to 4 different specialists, somebody needs to be, the ringmaster in that rodeo,
Circus, I think.
Circus. Okay. What's the rodeo one? What is that person called? Rodeo master.
Rodeo master. Let's call
all of you rodeo
master.
people out there going, yeah. Karen, what are you doing? But you have to. It's best if you have someone who's looking over all of your care, so things aren't just falling through giant cracks.
Oh, absolutely. We began our conversation today talking about the growing wait times to see specialists. And one thing I hear a lot of people saying about that is, oh, I've got really good insurance, so I can see anybody. And gets us back to what we were talking about before. That may be true. You'll have coverage if you need those people. But again, don't be that self-referral person.
Yeah.
Because you may delay the care you need with another specialist, or maybe it's something your primary care physician can do. But I hear that again, oh, I've got really good insurance.
Yeah. See, then all the more reason to see your primary care person first, because it's not going to hurt to see your primary care person and then a specialist for the same problem, because your insurance will cover it. So make sure if it's emergency, go to the emergency room. But if you can see your primary care person, then they can get a really good history and physical and some lab work, maybe some testing done to see really who you need to see. Because I have people all the time portaling me and saying, Karen, I have a cough. Please refer me to a pulmonologist. I mean, at least they ask. I mean, they say, because they'll say, who do you recommend for pulmonology? I'm like, well, I don't know that you really need a pulmonologist. Why don't you come in and we'll figure out who you need? Because it may be a GI doc because you're coughing because of reflux. It may be an ENT doc you need to see because you've got chronic postnasal drip. So you need to have someone other than Dr. Google sort that out for you and get you to the right place. Because if you refer to a pulmonologist for a cough, and that's not the problem, A, you're not getting your problem fixed, and B, you're taking up a slot in a specialist office that somebody who really needs to be there isn't able to be there.
Correct.
Because you think your cough is related to lungs somehow.
Right.
I mean, I know it makes sense, cough, lungs, but we get cough for a lot of reasons.
Sure.
So.
We haven't talked about this, but the wait times to see folks to deal with mental health issues is also long,
that's ridiculous.
And so that's another thing,
Yeah, I don't honestly know the answer to that problem because especially during COVID.
Yes.
Oh my goodness gracious. And the only people who were taking new patients were self-pay, cash only, no insurance. So that was a struggle trying to find people for my patients during COVID. Oh my gosh, that was a nightmare. So I don't know. That system has never been good in this country, to be honest with you. So it would be nice if we have things like BetterHelp, which is that online service. Mm-hmm. And that can be really useful for some people. So there are more, again, because of COVID, there are more options out there that are telehealth oriented. But we still don't have a good system in place, especially for any kind of mental health crises. So that's unfortunate.
I hear you saying be proactive with your own health.
Mm-hmm.
Don't call Dr. Google, and develop a relationship with your primary care physician.
Absolutely. Let them help you. Let them help you sort out what specialists to see. And help you probably get you in a little sooner, hopefully. So, well, it has been a great pleasure to have this conversation with you, and I know my listeners will really enjoy hearing your perspective. And I thank you for taking time out of this vacation in this lovely weather to sit inside and do my podcast with me.
It's been fun. I enjoy your work.
David Allen, thank you so much. Listeners, I encourage you to visit our Facebook page, I&B Podcast, where you can leave comments or questions for me. Our website is itchyandbitchy.com. There are blogs on the site with some of our subjects available for you to read. On the Facebook page and website, we have the information about how to schedule an appointment with me so you can chat with me about my perimenopause course and see if it can help you as you are going through this phase in life. As always, thanks to Forrest Wenzel, our producer and composer of our theme music, and the person who actually does the work of putting things on the website and Facebook page and producing the podcast. When I say we will do all this, thank you, Forrest. Check out his album called An Awful Lot. Go to wherever you stream your favorite music to listen. If you don't know where to stream music, you can find the album on Apple Music or Spotify. And as always, remember that your health is in your hands.